News alert. The problem you're dealing with that clicking and all the muffle sounds is coming from the jaw. I can't tell you how important it is to make sure that we keep our jaw muscles loose. They get so tense and so tight from stress, from poor posture, from just dental issues. There's been times and incidences where if you've gone in to get your tooth checked out, and just in that visit where your mouth is held open for too long can really generate all these issues in the jaw muscles and the jaw lining. So if you're turning your head or you're looking around and you're hearing these swishing noises, these crackling noises, don't always think it's something deep inside the ear. Think that it could just be simply the jaw muscles, the TMJ, and just the surrounding muscles, which is the masseter muscle particularly, that's so tight because of stress. We think maybe it's not that because of the fact that we've never had jaw problems before. We've never had issues with TMJ. We've never had dental issues. You'll be surprised, and I submit to you that if you just take time to massage the masseter muscle, literally, it's a very easy concept of massaging the muscle very lightly. You might not feel pain. That's what makes this very challenging to really dig down into, is that you don't have to feel any pain. You don't have to have had any abscess tooths or anything going on with dental care for it to be a jaw problem. I spent so many years searching and climbing through knowledge and details and websites and picking doctors' brains about what could this be? Why do I keep getting this when I eat? When I chew, I hear this crackling sound. And I'm going to tell you right now, it sounds horrible. It sounds like a building collapsing in my ear. For many years, I was always a little on edge thinking that this crackling sound can't be good. It literally sounds like my the bones and muscles are just falling apart. I hear this crackling noise. I was like, that can't be good. The noise is amplified. Our eardrums are right next to our TMJ and next to the jaw and the surrounding tissue and muscles. Now, do not get worried. Do not get alarmed. It's going to sound terrible in your ears. And I want to say that 9 out of the 10 times, it's not doing any additional and very harmful obstructive damage. But definitely, I'm not here also to say to do nothing about it. But I'm here to tell you to calm your nerves that it sounds worse than it really is. Now, I'd be walking around and I'd just be minding my business, get a phone call, start talking. The minute I say hello, pop, I'm like, okay, whatever. I'll continue my conversation. I just keep on going and going and going. I hear all this popping, this crackling noises. Then when I go and eat something, I hear crackling noises. It's one of those kind of things that can drive you into a state of anxiety and fear, just because you don't know what kind of damage is going on in there. And let me tell you, it's amplified when you see a doctor, because guess what? You go in, you explain to them the symptoms. They simply treat it as just an ear problem, write you a prescription, send you on your way, and then you continue to still hear the crackling and the swishing noises and all this other stuff going on. So now you're like, okay, I got my notification that I'm okay, I guess. I have medication to try to treat the ear problem, but meanwhile, it's still crackling and doing all this crazy stuff. That actually amplified the anxiety. It amplified the depression, because I'm taking what I've been told to take and I'm still feeling what I should be feeling. So remember, if you're in this position, do not worry, do not panic, do not get to the point where you're starting to obsessively purchase different things to try to figure out what this is. Take your time, relax. It's probably more than likely something you can solve at home. It's something that maybe can be solved by just being simply aware of what's going on. It could be simply how you hold your shoulders, how you hold your back. Take time to do very corrective stretches and exercises that over time you'll start to notice the benefits. You're not going to notice the stuff right away. Take time to stretch the neck. The neck gets tight in seconds, almost. And when you don't take time to stretch the neck, the surrounding muscles, take time to massage the masseter muscle, really put some work into it. Do it when your jaw is kind of loose, so massage it out. Take time to do those things. As far as dietary changes, do anything that's going to reduce inflammation. So in that case, you want to stay away from things that are high inflammatory. start going into the inflammatory side of things. I started developing a obsession of getting cruciferous type foods into my diet. Started trying to implement things that are more anti-inflammatory, because that's just going to take the pressure off those nerves and tissues and muscles and all the things that have been built up over time. So remember, the goal here is to apply awareness, apply the massage techniques, do those things while not adding to the fire. You can't sit there with a water hose on a fire, but you're adding gasoline and water at the exact same time. It's not going to undo the problem. It might not fully explode, but it's not going to get better. So keep that in mind. If you hear the crackling, the swishing, don't panic. Don't do what I did and run all over town looking for someone to help you and trying to deal with copay problems and insurance problems, because at the end of the day, it's probably something that can be corrected with just a little bit of research and lowering that stress. You'll figure out what the issues are. I hope this video was very helpful for you. If it was, please take time to subscribe to the channel. I try to bring content as often as possible. But in the meantime, I'm going to step out of the Jaye Wellness Studio and leave you in good hands with this video. Like anything else, folks, we're here to simply go back to the basics. Take care, everybody, and I will catch you in the next video.